Hello, good day, everyone. My name is Pharmacist Joseph Ebirim, and today I'd like to quickly try to make us understand what we mean by antimicrobial resistance from the community setting and why we are always particular about how you use those class of drugs that we call antibiotics. Right? Antibiotics, of course, it's a household name. It's a word that a lot of people can relate with. A lot of people who use medicines can relate to this. But when the pharmacist talks about, okay, don't take this way or take it this way, take this after some time and in this manner, take this particular one, tablets or injections or suspensions or, and all that. So a lot of people just think that, okay, that's big grammar and, it must not necessarily be that way or that's just too much jargon. But the truth is, there are different types of antibiotics. So there is no one particular drug or just a class of drugs that are the same that are called antibiotics. So when you say antibiotics, you're talking about different kinds of medicines that do one thing. They either kill a microorganism, mostly bacteria, or they prevent or slow the growth of those, bacteria. Now, how they do that is that they either alter some process in the bacteria that is essential, is necessary for that bacteria to live and multiply, right? Or they even prevent the bacteria from gaining access to the cell, or break the integrity, that's the cell wall, the body of the bacteria, causing leakage of important materials in the bacteria so that the bacteria shrinks and dies. So just trying to break it down. That's what basically these antibiotics do. So from even the three different examples I just gave you now, so you can see that it's possible that there are different types of antibiotics. So it's not necessarily one type. So there are different types. And now, because there are different types and they work in different ways, that also means that they will not all necessarily be taken in the same way. Deal? We understand that. So what it also means is that because they are also chemicals, and the body is filled with, it's a chemical environment. So different chemicals will get into the body and behave in different ways. So the way that chemical, that antibiotics, is known to behave will determine how it will be taken in form of a prescription. Will determine how it has been documented to be taken. So this is why the pharmacist or doctor will say, the physician will say, take it in a particular way. Do you understand? So you can see why the instructions are very typical and specific to that antibiotics. Now, if you understand this, you will now understand. So when next you're being told it has to be taken this way or that way, you do not now think it's just mere jargon, right? So there is an established way to get the best from this drug, this medicine called an antibiotic. So you follow that way. Now, let's quickly look at the fact. How do resistance develop? Let's look at the fact that I had earlier told you that these antibiotics either kill the organisms or slow their growth. Now, each time this antibiotic is exposed to the microorganism, that's the bacteria, for instance, the bacteria has some potentials to struggle to live. Just like any other person, when you're given something you don't like, you react in a way to knock off that thing because you're not comfortable with it. So whenever an antibiotic is introduced to bacteria, many bacteria have the tendency to experience some changes in them that is, these things are targeted to prevent the the dire consequences of the antibiotics in them. Now, if they are able to live even in the presence of the antibiotics, it means they have achieved resistance. And this happens when previously the quantity of the antibiotics that has been exposed to that bacteria is not enough to kill it. So that's what we call sublethal dose, right? So when this quantity that is exposed to it has not been sufficient enough to kill it or inhibit its growth, over time this bacteria will now develop those changes, and next time, even when you bring higher doses, it will no longer be able to suffer any harm in the presence of the antibiotics. So you see that this organism in this particular person is no longer being killed by the antibiotics, but that same organism in another person is able to suffer harm and dies because of the antibiotics introduced to it. Now, if the one that had developed those resistance if those bacteria are transmitted to another person, so same virulent species, same resistant species will now go to another person, and that drug will still not be effective in another person. And so when this spreads in the community, then you see certain drugs that were once effective no longer become effective. And that is the danger that pharmacists and healthcare professionals want to avoid when we encourage you to use your antibiotics properly. Is that understood? So that is the essence of this video, this clip, to say that it's not just mere talk. It's not just because we want you to have a certain medication or buy or whatever. It is a strategy. Preventing antimicrobial resistance is an important strategy for us to ensure that our society is healthy. Because if the drugs or medicines that could previously prevent these organisms from spreading or kill them and make people live healthier lives are no longer effective, then we have avoidable deaths now coming up. And no healthcare practitioner who really loves their profession will be happy about that. So please, the call to action here is that when next you have to take an antibiotics, let it be certain that you're taking the right antibiotics for the right reason and at the right dose and of course for the right condition. And you can get these boxes ticked the right by having it prescribed by a physician or even a pharmacist or an experienced nurse, according to the laws of the place where this prescription is coming or where you live and where practice is done. So I wish you all the best, and I hope this video can also help change lives. Now, let me conclude by also adding this. It is also important to note that even when we are constrained financially, there are alternatives. It must not necessarily be the one you have in mind. There are many different antibiotics that can kill a particular bacteria. Yes. So even if the one being prescribed for you is expensive and you can't afford it, you can also ask for an alternative. And of course, the risk and benefits will be explained to you. And it must not be injections. Injections are perhaps the last resort when the oral and other alternative routes that are safer can no longer be used, especially in cases of emergencies where speed is required. So, and if you have to take injections, you must know the medications. In fact, whenever you have to take medications, you must know the medication you're taking. It is your right. And only should it be administered to you by qualified, skilled, and licensed professional, because your health is very important and your life is what, the best attention and not just something that is handled by a quack. Thank you for listening. My name is Ebirim from Pharma-Guide, Nigeria, and I hope we've learned something beautiful today.